Hello, my name is Sam. I'm a GP. Today I'm going to give a talk on a topic called jaundice. Jaundice, by definition, refers to the yellow discoloration of the conjunctiva, which is the white part of the eyeball. Before I move on, I just want to take this opportunity again to revise the different pathological process that can affect the body. The mnemonic that I use is INTOMAT DDDD, I for infection and inflammation, N for neoplastic, T for traumatic, O for obstructive or compressive, M for medication or drugs, E for endocrine condition, including thyroid condition or diabetes, D for depression, and the remaining 4 Ds are deficiency and excess, degenerative, dysfunction, and developmental. So the two organs that we need to think about when we see patients with jaundice are the liver, number 1, and number 2, the gallbladder. So here's my table of the list of common and uncommon causes of jaundice. We will begin first by looking at common infective causes. Chronic viral hepatitis, including in particular hepatitis B and C, are known to cause jaundice towards the later stage of the condition. Acute virus infections such as acute hepatitis A infection, acute cytomegalovirus infection, and Epstein-Barr virus infection can all cause jaundice. In a condition called ascending cholangitis, inflammation of the bile duct impairs the flow of bile from the liver to the small intestine, leading to the congestion, therefore backflow of bile into the bloodstream, causing jaundice. Common obstructive processes include the gallstones, which can cause backward flow of bile and bilirubin into the bloodstream, causing jaundice. Medication and drug causes can also cause jaundice as well. Full-blown hepatitis can occur as a result of either prescribed medication, drug use, or excessive alcohol consumption. And full-blown hepatitis is usually associated with jaundice as well. Other common conditions include Gilbert's syndrome. In Gilbert's syndrome, there is a mild liver disorder in which the liver does not properly process the bilirubin, leading to yellowing of the eye. People generally present with very mild yellowing of the eyes and have no other symptoms. In a condition called hemochromatosis, there is an overload of iron within the liver. This impairs the liver cells' ability to process bilirubin and also affects the flow of bile within the liver, causing congestion, therefore backflow of bile and bilirubin into the bloodstream, causing jaundice. In cardiac failure, there is also a congestion of the liver secondary to impaired cardiac function. In this case, in a similar way to other conditions, there is an impaired ability of the liver cell to perform their usual function in processing the bilirubin, therefore causing jaundice. Next, we move to the less common causes of jaundice. First, we have got the uncommon autoimmune or inflammatory cause. In autoimmune chronic active hepatitis, there is chronic liver inflammation secondary to attack by the white blood cell, which is attacking the liver cell because of impaired immune regulation. And this subsequently leads to impaired bilirubin and bile processing, therefore backflow of bile and bilirubin into the bloodstream, causing yellowing of the eye from the bilirubin and bile within the bloodstream. In primary sclerosing cholangitis, there is a long-term progressive damage to the liver and gallbladder, characterized by inflammation and scarring of the bile ducts, which obviously impairs bile drainage from the liver to the gallbladder and also from the gallbladder to the small intestine as well. In primary biliary cirrhosis, there is a slow progressive destruction of the small bile duct of the liver, causing bile and other toxins to build up within the liver in a condition called cholestasis. And this causes a backflow of bilirubin into the bloodstream, causing jaundice. HIV and AIDS and septicemia also can cause jaundice in patients as well. Next, we look at the neoplastic process. Cancer of the pancreas, in particular, cancers of the head of the pancreas, cancer of the biliary tract, primary cancer of the liver known as hepatocellular carcinoma, or spread of cancer from other parts of the body that lodge within the liver, or can impair the usual flow of the bile, therefore leading to obstruction, congestion, and therefore backflow of bile and bilirubin into the bloodstream, causing jaundice. And finally, we have got cirrhosis as the cause of jaundice. Cirrhosis is the end stage of liver damage, causing scarring of the liver. And this scarring and damage to the liver can be a result of either infection, medication use, as well as chronic inflammation from all sorts of causes such as autoimmune causes. So I'd like to take this opportunity to revise this concept again. We only see what we actively look for. We only look for what we know. Therefore, we cannot see what we don't know. So it is very important that we have a list of common and uncommon causes of jaundice when we see patients who present with jaundice, so that we can work through the list and find out the most likely cause for the patient. Thank you for your time. Thank you for watching my video. If you like my structure, please kindly subscribe to my video channel. Thank you. And this is my disclaimer. Thank you.